Hi guys, Jason here from Strengthen You, your fitness and therapy experts. We're going to be talking about common lower body issues today, especially when your knees cave in, resulting in lower back pain during the squat. So when we're looking at the hip, what's very common on the therapy side that we see is hip flexors, especially the TFL, which is kind of the pocket muscle right here. It's overly used, and the glute medius muscle and minimus next to it is pretty much undertrained. So we can't really attack these muscles through big compound movements like the squat and the deadlift. We need to address them specifically and isolate them with different exercises. A lot of the ones you may know, clamshell with the band around your knees and some side lying rotations. So I'm going to give you 2 intermediate exercises today to limit any knee pain you're getting, as well as keeping your lower back nice and safe and train the muscles that are undertrained in the hip. All right, so some background on the hip. When we talk about the TFL, I said it's the pocket muscle right here. When we're sitting for extended periods of time, or we're doing a lot of exercise and not addressing the proper muscles, it gets very tight and short. Thus, the whole body starts to overcompensate a little bit in the QL, the lower back, and as well in the psoas and the rest of the hip flexors. This creates pain in the body, and you're not really using it the proper way. All right, so the first exercise we're going to be using is going to be a Bandit glute bridge with a little bit of external rotation at the top. I really like this one because you're really forcing the knees out, keeping the glutes contracted, and pretty much every muscle of the glutes are going to be firing. So first step is going to be putting the band just on the outside and above the knees. Okay, I'm going to try to put the bench on my upper back. My heels should be right below my knees, about a shoulder width or hip width stance. I don't want to be arching my lower back like so, right? I want to make sure everything is neutral. I'm dropping my whole body down, keeping everything neutral, coming up. And at the very top, I'm going to be forcing my knees out to get that full external rotation. Coming back in a little bit, coming back down, coming back up, and forcing out. This would be a great one to add some weight to challenge yourself, but tempo will be your friend with this one. All right, so the second exercise is going to be a single leg landmine RDL. The reason why I chose this one, it's a little bit advanced for some people, but most people are able to accomplish it. You do have a landmine attachment to kind of keep you in the same groove. So what you're going to do is place your 1 foot down, 1 foot spaced out, again about hip width. What I'm really focusing on is keeping this foot down. My opposite arm is going to be grabbing the weight. My left leg is going to be slightly bent. Both my knees are going to be soft. But I'm really trying to make sure my left foot, when I'm doing the lift, doesn't open up like this, okay? We want both of our hips to be stacked and to be loaded. We don't want anything opening up. So I'm gonna come right here, keep the weight on the right foot right here, on the midfoot. I'm gonna go down as low as I can, keeping everything in a nice straight line, and come right back up. So right now, the right glute, glute med, glute min, hamstring, all the posterior chain is firing up the whole time. Okay, obviously my core is tight, my lower back is neutral. I'm not trying to overextend at any part of the movement. All right, I'm also putting some pressure to the lateral side of the bar. That way I don't move around too much. All right guys, so hopefully you found those 2 exercises useful. Just remember, whenever you're addressing any type of pain, you should always be looking at the whole body. Typically there's one muscle that's going to be overcompensating for other ones. Again, I'm Jason from Strengthen You. You're only one strategy away from crushing your next fitness goal.